Melissa Meisty here from Nephew Physical Therapy. As a physical therapist, I am not in the emergency care business. As most doctors' offices' messages say, if this is an emergency, please call 911 or contact your nearest emergency room. We're more in the we show up later after the injury, after surgery, or when you're sick and tired of being in pain. However, on one such Friday night, the bat signal went out where I was called by a family member because they were laying on the floor writhing in abdominal pain. Now, the interesting thing about abdominal pain is we can jump to things like kidney stones and gallstones and maybe appendicitis. And so as physical therapists, did you know that we are supposed to be able to do such things as differential diagnosis? We're determining when we see you for an evaluation or on this such Friday night, why in fact might this pain be happening? And on our end, is it mechanical? Because there's something we can do to move it, make it worse, make it better, and that helps us determine whether or not this actually falls under our purview. So I show up, I'm asking a lot of questions because that's what we do, wanting to understand the situation. And while this situation wasn't related to the pelvic floor, I have taken a few pregnancy and postpartum courses over the year. And do you know what one of the most common problems women experience after having a baby? After they've been on their medicines and all kinds of other things? Constipation. I know, the C word nobody wants to say, right? But having bowel issues, that's right, poop, when you're having issues with that, it can cause a lot of pain. And your system, just like your plumbing at home, can back up. Well, after a few questions and some poking and prodding, I was pretty certain this emergency on a Friday night was because of gas. What's my advice for that? Well, actually, I do have a couple of tools in my tool belt that help with this. The first one is water. Obviously, we need motility, which is the fancy word for movement. And if that poop gets stuck, as it might in your camper, if you let the black valve open, things will dry up. So drink lots and lots of water. It's also my advice to my kids every night they wake up, something hurts, drink a glass of water and see me in an hour. So hydration. However, what you need to do is actually get yourself in a position to allow the gas to come out. Yes, my prescription was fart, fart, fart. But it's true. So one of the best things is when you're having that kind of abdominal pain is laying on your back and putting your lower legs on an ottoman, on the couch, so that your knees are in a 90-90 kind of degree position that allows things to relax and opens up that anal sphincter. The last tip is actually you can do a self-massage to your large intestines. It's actually pretty easy. You start in the groin of your right hip, go upwards, go across underneath your ribs, and then come straight down, lining up with the left hip. That is the pathway of the large intestines. And you do that in let's see, that would be a clockwise motion. You go up, you come across, you go down. And you keep repeating that. Again, with fingers crossed that those flatulence are going to start flying. We can joke about this because, of course, if you're like me, you've had embarrassing moments where something's kind of slipped out and you farted in the most inappropriate places. But when you're in pain, writhing in pain, and wondering if you should go to the emergency room, maybe, just maybe, you'll stop, hydrate, reposition, and do a little self-abdominal massage. It might save you that emergency room trip. And the ultimate goal is a solid trip to the bathroom. Melissa Meisty here, giving you all the tips for all different kinds of pain. Because pain, even gas pain, should not be normal.